Hi, good morning Linson. My name is Joyce Parker. I'm your invigilator for the OET speaking session on the 1st of September 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Linson Maddie.
And what is your candidate number, please?
My candidate number is 202214223.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What motivates you to pursue a career as a nurse?
During my childhood, a close friend of mine got sick, and I was devastated. My parents tried to console me, but it was only after I visited her in the hospital that I began feeling better. A very kind nurse displayed such composure, warmth, and optimism, guiding me through the regimen my friend was going through, and reassuring me that she'd be fully recovered soon enough. And indeed, she was. I then told my parents I'd decided I would become a nurse myself. Basically, I fell in love with the field early on, and I knew that I could transmit that passion to diligently care for patients, with a team of nurses and physicians.
Do you work well under pressure?
By nature, I'm very even-tempered, and that has given me strong foundational protection against stress. I also practice mindfulness and meditation daily, which has helped to further strengthen my mind. Additionally, I'm a runner, and I've found that jogging a few miles every weekend always helps me to clear my head and brace myself for the coming work week. And recently, I attended a symposium on workplace stress, which taught me about stress reduction techniques, such as taking walks during my lunch breaks to avoid burnout.
How do you create a rapport with other nurses and doctors?
I love working on a team with a sense of purpose. And being part of any healthcare team has always given me true meaning and incentive. I try to remain selfless, flexible, and dependable. When a fellow nurse once asked me to look after her patient for an hour, while she attended to a personal emergency, I ran over to the hospitalist to get briefed on the patient, and I was then able to care for him, in addition to the other 2 patients under my care, by forgoing my lunch hour. Of course, the team was very grateful, and I knew they'd do the same for me.
What makes a shift satisfying to you?
At the end of a long shift, I feel really fulfilled when I see how my team has effectively followed all safety procedures, using the proper documentation, how we supported each other throughout some grueling hours, and how we all displayed enough resilience to get up again and conquer another workday.
Where do you see yourself in 5 years?
I'm looking to become one of the most productive nurses on my team. I want to be indispensable. And eventually, I'd love to raise my status to a nursing team leader and even help with training. But before that, my plan is to obtain my Master of Science in Nursing, so that I can become an advanced practice registered nurse. My dream is to be able to go deeper with patients, by evaluating their test results, helping doctors with diagnoses, and referring them to specialists.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. Now you can start your role play. Don't worry if I stop you when the time is up.
Good morning. My name is Lipson Maddie. I am the school health nurse. Am I talking to Joe Parker's mother?
Good morning. Yes, I am Joe Parker's mother.
How may I address you?
You can call me Joyce.
Okay. How are you, Joyce?
I am good. Thank you for asking.
Joyce, have you noticed reddish sores on Joe's face?
Yes, I do.
Did you take him to consult with his GP for the condition?
No, nurse. It seems to be small, and I hope he will be recovering in no time.
Your thoughts are sensible, Joyce. You have been called here to talk regarding the red sore on his face. I will provide more details regarding the same.
All right, nurse. You may please.
The red sores on his face are not a normal soreness, as you think. It is caused due to a bacterial infection. The condition is called Impetigo.
Oh, I see.
It usually appears as reddish sores on the face, especially around the nose and mouth, and also seen on the hands and feet. Over about a week, the sores burst and develop honey-colored crusts.
What should I do to protect my son from this bacterial infection?
Don't panic, Joyce. This is a common condition seen in children. It is treatable. I suggest you take him to consult with GP and get appropriate treatment at the earliest.
Sure, I will.
Impetigo is treated with antibiotics that are either topical cream, that is, rubbed onto the sores, or taken by mouth, the oral antibiotics. A doctor might recommend a topical ointment for only a few sores. Mostly, oral antibiotics can be used when there are more sores.
All right.
Most importantly, Joe's condition is contiguous.
Is it?
Yes, but try not to worry, Joyce. Treatment with antibiotics can limit the spread of Impetigo to others.
Okay.
Joyce, you should keep Joe at home from school or from any sort of outside activities until they are no longer contagious. Children of his age will mingle with each other closely and can spread the condition so easily.
I understand your words, nurse. I will take care of it.
Thank you for your understanding. Also, Joyce, from the records I can find, he is having siblings.
Yes, nurse. He has 2 siblings.
As I mentioned earlier, his condition is contiguous. I would like to inform you that Joe should be isolated from them. It is very easy to spread among siblings, as they will be having very close interactions with each other.
Well, nurse, I will shift him to his grandmother's home. So, he will not be feeling lonely, on the other hand, gets isolated from his siblings.
That is a great idea, Joyce. I assure you that this will not take too long to be cured with the medication. Therefore, he will soon be able to restore his normal life.
All right, nurse. I got it.
In addition, I wish to provide some information regarding the care Joe requires.
Definitely, you may please.
Thank you. Joyce, the first priority to avoid such conditions is to maintain hygiene. Proper hand hygiene is very essential to stop spreading such conditions.
Yes, you are very correct, nurse.
Moreover, to prevent the spread of infections, kindly wash his clothes separately, and it is recommended to use hot water.
That's perfect. Definitely, I will do as you suggested.
Is there any clarification needed from my side, Joyce?
No, nurse. I understand what you have said.
Joyce, let me summarize what we have discussed so far.
Of course.
We have discussed what Impetigo is, and the nature of the condition. The condition Impetigo is treatable, and care should be taken, since it is contagious.
Yes.
Further, we discussed Joe's treatment. First priority is to consult with the GP and get medication. Secondly, isolate him to avoid spreading. I hope all these points are clear to you.
Yes, nurse. And thank you for your information.
My pleasure. Thank you for listening to me, Joyce. I wish Joe a speedy recovery.
Thank you, nurse. That is the end of your OIT speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.